Hey, welcome everybody to the April meeting of our nonprofit plant-based nutrition organization of Wisconsin group, or we like to call ourselves PBNOW. I'm your host, Terry Lynch. The mission of our nonprofit group is to educate, inspire, and support each other on an evidence-backed, whole plant food-based nutritional path for a healthier, happier life. Our group is open to everyone, those plant-based and those just curious about it. It's meant to be a non-judgmental place to get information, inspiration, and support. If you'd like more information about our group, our upcoming meeting dates, speakers, and resources, or to check out videos of our past meetings, just Google us at PBNOW. As we do each time, can I see a show of hands by either raising your hand or using the thumbs up reaction icon on the bottom of your Zoom screen to show how many of you are currently following a plant-based lifestyle? Well, we see a lot of thumbs popping up there. Oh, that's great. Thank you very much for doing that. As we mentioned at the beginning of each meeting, the evidence of the benefits of plant-based nutrition and improving health and quality of life for people of all ages, as published in non-biased medical research, is quite striking. Whether it's improving health through increased energy, weight loss, strengthening our immune system, preventing, slowing, stopping, or reversing problems like allergies, digestive problems, diabetes, heart disease, and early dementia, or increasing our quality of life by helping us feel better quickly, increasing our endurance, improving athletic performance, speeding recovery from exercise, reducing joint pain, clearing thinking, or reducing the physical, emotional, and financial side effects of the illnesses, drugs, and procedures often recommended to treat the conditions plant-based nutrition can help us avoid. The research shows our bodies do a wonderful job of healing themselves if we stop damaging them daily with poor nutrition and start giving them the nutrition they need to heal and function optimally, so we have a better chance to enjoy each day of the rest of our lives. It's truly remarkable. Now let me tell you what's in store for you tonight. Tonight, we're going to hear from 3 speakers. Our first speaker will be our medical director, Dr. Joshua Liberman, with some comments. After Dr. Liberman, plant-based coach and physical therapist Michelle Stamm will briefly speak to us. And following Michelle will be our featured speaker and giant in the plant-based nutrition community, Dr. Caldwell B. Esselstyn, Jr. We hope to have time at the end of Dr. Esselstyn's talks for you to be able to ask him questions and him to give us some answers. Tonight's program should end about 7:30 p.m. As a reminder, we have meetings every month, usually on the second Thursday of the month at 6 p.m. Central Time. Next month, we'll hear from Denver cardiologist, Dr. Andrew Freeman, and in the future, we'll be hearing from Dr. Michael Greger, Dr. Neil Bernard, Dr. Michael Clapper, Ann and Jane Esselstyn, and Brian Hart, among others. We'll post more information about our upcoming meetings on our website at pbnow.org. I'm sorry, pbnow.org, not .com, but .org. If you register on the website or are already registered, you'll receive email reminders of our events as they approach. Last, a quick technical note. During the meeting, everyone but the speakers will be muted, and we ask that you stay muted to avoid background noise and allow everyone to hear the speakers. With that, let's begin with our first speaker tonight is a fellowship-trained cardiologist. He is president and CEO of Wisconsin Cardiology Associates and is past president and current trustee of the Wisconsin chapter of the American College of Cardiology. He's a member of the American College of Cardiology's National Nutrition and Lifestyle Work Group, whose membership includes nationally known physicians such as Dr. Dean Ornish, Dr. Neil Bernard, and our featured speaker tonight, Dr. Esselstyn. As a matter of fact, last weekend, our first speaker spoke on a panel that included Dr. Bernard at the annual American College of Cardiology's National Conference in Orlando that attracts something like 50,000 cardiologists each year. He's an advocate for the use of plant-based nutrition to help improve heart health, general health, and quality of life, and has seen the benefits of plant-based nutrition in both his personal life and that of his patients. We are fortunate to have him here in Milwaukee and as our PBNOW medical director. I'm happy to welcome Dr. Joshua Liberman. Dr. Liberman.
Thank you, Terry. Thank you for the introduction. That's kind as usual. Hopefully everybody can hear me okay, and glad to see such a huge crowd to listen to myself and Michelle teach you guys about plant-based lifestyle. I know you guys all came for us to. No other reason to be on the call tonight, especially. For those of you who are new, welcome. We love having everybody here, and you're welcome to join us the second Thursday of every month. And as Terry said, we have a great lineup of speakers. Not just tonight, of course. We have a great lineup tonight, but every month we have different perspectives on how you can get healthier through plant-based diets and through healthy lifestyles. For those of you who who have not been here before, as Terry said, I'm the medical director. I like to introduce the conference the meeting by talking about two general things. One is, sometimes a patient case from my practice, and the next is just a little bit of, a factoid or tidbit from the literature that's sometimes recent, sometimes something I just learned as well, and then we can move on with the rest of the speakers. So I guess we'll start with a patient I actually just saw about 2 hours ago. My last patient of the day came to see me, 59-year-old man who about 8 years ago had a calcium score test done. We've talked about that in these meetings before, but basically it's a test to look to see if somebody has evidence of heart disease already. And so at the time he was in his early 50s, and it showed that his calcium score was something in the 90th percentile. So it was a lot. It was a very high burden for a fairly young age. And we kind of did typical things, talked to him, of course, about diet, lifestyle. And for him, because his score was so high, I put him on some medication. And we've been working with him since then, and he's done pretty well, but he's never really bought into a plant-based diet as much as he comes to see me regularly. Not everybody is ready to make that decision. But the last time I saw him, his numbers had gotten a little bit worse. I saw him, I think it was December. The last time I saw him, his numbers had gotten a little bit worse. And we were at the point where I said, this is not a range where I think it's healthy to be with kind of your burden of heart disease. So I think we're at a crossroads. We have a decision to make. Either we add more medication, or I think, you really got to tighten up the diet. He had already been exercising. He runs, something like 5 miles 3 times a week and does a bunch of other exercise. So it wasn't really that. It was clearly the diet that I thought he needed to clean up. And he said, all right, I don't really want to be on more medication. Let me try this, right? And so he came back to see me today, and we had labs done last week. And sure enough, his LDL, his bad cholesterol, had dropped from 96 down to 66, so a 30% drop. And his other numbers were all great. His triglycerides were great. His HDL was great. His marker of inflammation, the CRP test, was great, and everything was great. And so I talked to him. I said, all right, so this is great. What did you do? And the funny thing is, he didn't even completely commit to a plant-based diet. He moved in a much more plant-based direction. He said, okay, I gave up my burgers. I gave up eggs. And I'm now using almond milk instead of cow milk in my cereal. Now, it's not like he's eating chicken every night or anything like that. I mean, he already had moved in that direction, but he gave up just a few things, and then his numbers got dramatically better. And I was able to use that as a learning opportunity. I said, listen, look, you didn't even do that much in the greater scheme of things, and look how much better your numbers got. Just imagine how much better you could do if you moved even more in that direction. And maybe then you can even think about decreasing or potentially even getting off medication, I suppose. So it was a really nice conversation. It was a really nice microcosm of what we do in this world every day. And it really, again, was one of those teachable moments where, for me too, to see how powerful. I mean, it's interesting. Obviously, I lecture about this. I talk about this. I'm on this meeting. I talk to other professionals about it. It's part of my life. But on a daily basis, I get reminders of how powerful nutrition is, and just the role of nutrition in our health. That even small changes can lead to dramatic benefits. And of course, the more you change, the more dramatic your benefit is. And as Terry said, I was at the American College of Cardiology conference this past weekend down in Atlanta. It's a big deal. As Terry said, it's like something like 50,000 cardiologists from all around the world descend upon wherever the conference is. This time it was in Atlanta. So don't have a heart attack at home when you're in this conference, because there's no cardiologist around. Just kidding. There's plenty still on call wherever you are. But in any case, it's a very safe place to be, surely. But it's good. There's a lot of science that gets presented. There's a lot of conversations. There's a lot of panels. There's a lot of everything. And I was on a panel talking about healthy lifestyles. It was a bunch of different topics within healthy lifestyles. But surprisingly, there wasn't a lot of plant-based research that came out of this conference. Surprisingly or not surprisingly, I mean, there's been more and more coming out in recent years, but there wasn't any earth-shattering or science-changing healthy lifestyle stuff in this conference. But there's conversations that happen, and so I was able to talk to some of my mentors, some of my idols, Dr. Barnard, of course, but I was also able to talk to Dr. Kim Williams, who's talked to us before. He's a very prominent cardiologist. He's now in Louisville, Kentucky, and we were able to catch up, and we were talking about just approaches to prevention in general. And there was one thing that we were talking about, and that was a big topic at this conference, was this protein, this risk factor that we know about called lipoprotein A. So I don't know that I've ever talked about it on this meeting before, on these Zooms before. But lipoprotein A is a protein that is increasingly identified as being a major factor in risk for heart attack and stroke. The problem with lipoprotein A is that it doesn't show up on normal tests. I mean, so you have to actually specifically order it. But the bigger problem is that it is genetically determined. And so when people talk about having a family history of heart disease or stroke, sometimes we find what they really mean is that they have a genetically high lipoprotein A. It's being passed down from generation to generation to generation. And the problem is we don't have anything to treat it. There are no medications that affect it. Estrogen can lower it a little bit. There is there's some research that shows that high dose vitamin B3 niacin can lower it, but unfortunately, that research didn't show that it actually led to reduced heart attacks or strokes. But in any case, so we know that there's this risk factor, this lipoprotein out there that leads to higher rates of bad events, but we have no way to treat it, right? And so I was talking to Dr. Williams. He said, actually, there is some evidence that there is a way to treat it. And he pointed to me this journal article that I missed. It was years ago. It's from 2018 in a journal called Clinical Cardiology, where they did look at putting people on a plant-based diet to see if it would affect lipoprotein A. And sure enough, it did. They did it after just 4 weeks. They took 30 people. So it's a small study, and honestly, really should be done on a higher scale, on a larger scale. But they put people on a defined plant-based diet for 4 weeks, and they saw that the lipoprotein A actually decreased by a very significant amount, by 32 points, which is a very, very significant amount. And it was statistically significant, even though it was a small study. And of course, the plant-based diet reduced bad cholesterol particles, small particles, which some people think are even more dastardly and devious. It reduced apolipoprotein B, which is another way we can measure bad cholesterol. Plant-based diets reduced markers of inflammation, which we kind of expect to know, but they also highly oxidized lipoproteins too. So really everything that you would want to be reduced got reduced with a plant-based diet. But this is the only thing that I've come across, and again, it's in published research, that can lower lipoprotein A, and that sure enough is the plant-based diet, which we all know and love. So every conference I learn something. Every time I talk to Dr. Esselstyn or Dr. Barnard or Dr. Williams or any of these people, I learned something. But this time I learned something that was in research from 6 years ago. But certainly I think it's going to inform my practice and moving forward. So with that being said, thank you all for being here. Welcome, and I'm going to give it up to Terry and Michelle.
Thanks so much, Dr. Lieberman. That was outstanding, very interesting, and extremely encouraging. All right, so let me quickly go to Michelle here. Our second speaker tonight is a certified plant-based health coach and physical therapist based here in southeastern Wisconsin. She's the founder and owner of Wellness Empowered, where she teaches people through virtual appointments how to incorporate plant-based eating into their daily lives, increasing their chances of successfully reaching out or reaching their goals and reaping the many benefits that plant-based nutrition has to offer. I've asked her to put up her contact information at the end of her brief remarks here. Michelle?
Well, thank you so much, Terry, and thank you everybody for being here tonight. Tonight, I find myself in kind of an interesting situation, sandwiched between two very smart physicians. So I have chosen to not even try to share anything sciencey with you, and instead, I'm going to share some encouragement with you tonight. And in true Michelle fashion, I'm going to do it with a story, and it's probably not the story you expect me to share, but a few weeks ago, I was attending a marketing conference. You see, I'm a pretty good health coach, but I still have a lot to learn about marketing my business. And one of the things I learned at this conference was that I should integrate my landing page with my website. And oh yeah, I needed to integrate those things with my YouTube channel as well. Now, all of this sounded like a really good idea to me, and I could easily see how it would work well for what I am trying to accomplish. The thing is, how I had those things set up, none of it was integrated at all. So when it was suggested to me to integrate those things, I'm telling you guys, my brain nearly broke. This led me to maybe 10 days or so of thinking things like, I don't even know what all this means. I can't do this, and I don't know where to start. And overarching all of those thoughts was the big one. I am so overwhelmed. Now, maybe that is how some of you guys feel when you walk away from these PBNOW meetings. You hear a lot of science and you think to yourself, I don't even know what that means. Eating a plant-based diet sounds like a really good idea to you. You could easily see how this would work well for your health and help you to accomplish the wellness goals that you have to improve your health. But then you think, I can't do this. I don't even know where to start. And then as you try to figure out how to make a plant-based diet actually work in your life, you feel like your brain might actually break. And you tell yourself, I am so overwhelmed. If that's you, let me tell you what happened next for me. I decided that it was time to stop allowing myself to spin and indulge myself in overwhelm. So I put on my big girl pants and I made a decision to not be overwhelmed anymore. Now, once I had made this decision, I spent a few minutes looking up how to integrate those things. And honestly, I had everything set up in less than 30 minutes. Yep, less than 30 minutes of work after 10 days of allowing myself to be overwhelmed. How foolish of me, and what a waste of time. Just think, if I had decided to not be overwhelmed 10 days earlier, I could have avoided so much stress and would have had all of this set up so much sooner, which is why I want to encourage you guys tonight to make a similar decision. For those of you who have not yet given plant-based eating a try, I want you to decide to not be overwhelmed and instead just get started with a plant-based diet. I think it's going to be a lot easier than you think it's going to be. One of my clients told me that she has realized that cooking plant-based really doesn't take any longer than how she used to cook, and this was just a fallacy that she had believed. Another client commented to me that cooking plant-based has actually been fun and not stressful. And she said she was also surprised to find out that it hasn't been time-sucking like she thought it was going to be. A couple that I'm working with told me that one of the best and most surprising things of going plant-based is how easy it has been for them to find foods to eat and actually enjoy. And one more client I want to tell you about, one who I will tell you was very overwhelmed when she started on the plant-based journey. She told me that she just doesn't see this as hard anymore and can't believe how easy it is, and that she can't stress the ease of this enough. I know that's a lot, because she's now so excited about how easy plant-based eating is and how great she feels. She just can't stop talking about it. By the end of our time working together, she told me that she just doesn't think about it anymore because eating plant-based is just part of her life. Now, not only is it easier, probably, than you think it's going to be, the results you're going to achieve in your health are absolutely amazing. Now, for the sake of time, I'm not going to share all the details, but that small handful of clients I just told you about, let me tell you a few things about them. They've lost so much weight collectively, and one of them has lost 35 pounds already in 2024. And you guys, it's the beginning of April. That's amazing. They've lowered their cholesterol. A couple of them lowered their cholesterol by 50 points in just 6 weeks. They've decreased their joint pain and inflammation so much so that they're like moving and exercising and climbing the stairs without pain now. And one of them was able to stop taking prednisone for the autoimmune condition that she has. One of the women that I work with, her PMS has improved so much that she no longer has monthly migraines, and she feels like she's off that emotional roller coaster that so many of us know. So much so that one of her kids commented she heard him talking to somebody and said, yeah, my mom's not so cranky anymore. So a big deal. And one of these people is in the process of reversing his diabetes. And there's more, and I'm going to stop there though. All of these wonderful things are happening to these wonderful people because they made a decision to not be overwhelmed and to instead just get started with eating a plant-based diet. Now, when I allowed myself to be overwhelmed for that period of time with my technology setup, I experienced some unnecessary stress and, just didn't get the job done as quickly as I should have. But when you guys are allowing yourselves to be overwhelmed about trying a plant-based diet, the stakes are so much higher because you're delaying something so much more important, your improved health. All the amazing results that I just talked about and Dr. Liberman talked about, and the ones you're going to hear from Dr. Esselstyn as well. So as you continue to listen on tonight, I really encourage you to make that same decision I made. Do not allow yourself to be overwhelmed and instead just give plant-based eating a try. I really think it's going to be easier than you think it's going to be. So, okay, I'm going to share my screen here. Hopefully you can see up on your screen. You can still see me. See all the technology I'm figuring out, you guys. Up there on the screen, there's a QR code. And if you want to sign up for my weekly newsletter, you are invited to do so. I would love to have you join my community. What do I share in there? I share, yes, things like my favorite plant-based recipes and my favorite plant-based resources. I share encouragement, like the stuff you just heard tonight. And my favorite thing to share is my client testimonies. I'm going to, you get even more details about how great these people are doing, which I find can be so encouraging to hear other people's fantastic plant-based stories. I want to tell you, I'm currently working on a roadmap that is meant to really help people get started on a plant-based diet. If you want to hear all about it, be on my mailing list. You'll learn about it there. But I'm not going to just talk about, 10 steps to give up dairy or something like that. I'm going to talk about these mindset pieces, these social pieces that really trip a lot of people up. Love to share all that with you. And if you are still feeling overwhelmed at the end of the night, I get it. Believe me, I just shared. I've been there pretty recently myself. So if you're feeling overwhelmed, you're exactly the kind of person that I love to help get you past that overwhelm and get you onto experiencing those great results. So please email me and we'll set up a time to talk and get you started. So, all right, guys, thanks for listening. And I'll throw things back to Terry. Thanks.
Thanks, Michelle. Great stories. And I know there are a lot of people who have unfortunately probably not gone plant-based because they did feel overwhelmed. And it helps to relax a little bit and give it a shot. And it really helps to have a guide doing it too. So I certainly encourage people. Michelle does an excellent job.
Thank you, Terry.
You're welcome. Now for a featured speaker tonight, who is both a pioneer and a legend in the field of plant-based nutrition and lifestyle medicine. He has saved literally thousands of lives through his work as a surgeon, researcher, author, and plant-based nutrition advocate. A Yale grad with a medical degree from Western Reserve University, he won a gold medal as a rower on the U.S. Olympic team. He was awarded a Bronze Star as a surgeon in Vietnam. He practiced surgery for over 30 years at one of the top 2 hospitals in the world and the #1 heart hospital in the world, the Cleveland Clinic. He risked his professional reputation by conducting and publishing research on a new way to address the #1 killer of men and women in the developed world, cardiovascular disease. Dr. T. Colin Campbell, Professor Emeritus of Nutritional Biochemistry, Cornell University, and co-author of the China study, has said of our featured speaker, quote, his determination to pursue this research and to teach the rest of us what he has learned against formidable opposition in the medical establishment is a testament to his personal and professional courage and integrity, unquote. The pioneering research our speaker undertook and our speaker's tireless advocacy teaching the rest of us what he has learned has not only already saved thousands of lives, it is likely to save millions more lives in the future. But far be it from our speaker to rest on his laurels. At age 90, he's still kicking it. He continues to enthusiastically commit himself to helping others. Among other things, he directs the Cardiovascular Prevention and Reversal Program at Cleveland Clinic's Wellness Institute. He continues to speak to medical professionals and the public at conferences. And through his Esselstyn Family Foundation, he and his family get the life-saving word out, showing people how to take control of their own health and live long and vibrant lives. He and his wife, Ann, have followed a plant-based diet since 1984. Together, they've raised 4 children, have 10 grandchildren, all of whom are plant-based. It's my distinct honor and privilege to introduce to you our featured speaker, Dr. Caldwell B. Esselstyn, Jr. Dr. Esselstyn.
Terry, I want to say thank you for those kind words. And I look forward to being with you and your team today to see if we can't throw a little more light on what's going on in the world of whole food plant-based nutrition. The thing that I want to talk about tonight is really it will replace what I think is a black eye in the medical profession, both in New Zealand, Australia, South Africa, Europe, and the United States. What do I mean by the black eye? We have known for probably over 90 to 100 years that there are many actual cultures throughout the planet where cardiovascular disease is virtually non-existent. And yet, in that 90-year period, have we brought the information from those cultures where heart disease is non-existent? Have we brought that to this country? No. We have devised drugs, stents, and bypasses, none of which have one single solitary thing whatsoever to do with the causation of heart disease. So let's see if we can't. Thank you, Brian. Mm-hmm. And here are some of those cultures which 90 years ago, cardiovascular disease was very infrequently seen. Why? Because they're thriving on whole food plant-based nutrition. Now, this is the oldest slide in my presentation, and I share it because it reminds me that when we autopsy our young GIs who died in combat in Korea, for example, 80% of those average 20-year-olds already had gross evidence of coronary artery disease, not enough, to have a heart attack or a significant clinical event, but there the disease was already established. Now, this, I should give you a little background. This slide actually comes from, as I was leaving Vietnam, having spent a year there as a combat surgeon, it really was rather an exciting moment because we were coming home after a year. Now, that study that I just mentioned was repeated 45 years later. And this time looking at young women and men between the ages of 17 and 34 who have died of accidents, homicides, and suicides. And now, in these young people, the disease is ubiquitous, everybody. So if any of you are in the audience who are over 17 and you've been eating the typical Western diet, know that you're already starting to lay down the foundation of plaque through your coronary arteries and perhaps some other arteries as well. Now, this is just the study that I mentioned in JAMA in 1999. But now, here's where we had a chance to absolutely get it right. And this was in World War II when the Axis powers of Germany overran the Low Countries of Holland and Belgium. And they took away their livestock for their troops. So their cattle, their sheep, their goats, their pigs, their chickens, their turkeys were now gone. And these Western European nations were now becoming plant-based. This included Holland, Belgium, Denmark, and Norway. Now, the interesting thing was that Dr. Strom and Jansen decided to look up in Norway the number of deaths from heart attack and stroke during this time period. And lo and behold, if we start together here on the left, you can see that deaths from heart attack and stroke going up in 1927, going up in 1930, going up in 1935, in 1939, in come the Germans. And whoop, yeah, down goes the deaths from heart attack and stroke. Who knew the Germans were these great public health educators? But look what happened. In 1945, with the death of Adolf Hitler, the cessation of hostilities in the European theater, back comes the meat, back comes the dairy, back come the strokes, and back come the heart attacks. Sadly, we didn't understand or get it right. Now, we're going to shift gears here a little bit. Obviously, on the left, you can see a wonderful normal artery. On the right, an artery, obviously, that is terribly diseased. And you're probably saying to yourselves, when that small little remaining opening in the middle, when that closes, there'll probably be a heart attack. Well, interestingly enough, only about 10% of heart attacks come from something like this. Yes, it's going to cause you shortness of breath and some chest pain and angina. But what happens is these are these lesions that we are looking at on the right-hand side are really quite slow growing. And as they are slow growing, the downstream heart muscle recognizes that it is being deprived of its normal blood flow with oxygen and nutrients. And it often will build little threads around it. We call collaterals. Those you can see on an angiogram are tiny little blood vessels that the body has built so that when that small opening finally does close off, there is still enough blood supply through the collaterals to sustain the downstream heart muscle viability. But now let's go a moment to the artery on the left, and you will notice a tiny, even those of you in the back of the room, there's a tiny little dark line on the innermost lining, and that's the endothelium, which I'm going to have a fair amount more to say tonight, but that's anatomically where this endothelium resides that I'll be talking about. Now, when we in the States begin eating the milkshakes, the pizza, the cheeseburgers, the first thing that happens is our cellular elements get sticky, sticky, sticky. Our white cells get sticky, our endothelial cells get sticky, our platelets get sticky. And now I'm going to share with you a slide that I borrowed from Peter Libby of Harvard. And the area that is blue is where the blood is flowing. And what separates the flowing blood from the artery are these tiny, single little endothelial cells that are painted purple in this side. Now let's do this together. Let's go to the upper left-hand corner, and there is, and there painted orange is your LDL, your bad cholesterol. But you've been eating these nasty foods, the pizza and the milkshakes. And what happens is those substances create a lot of inflammation, especially from what we call free radicals. And so the inflammation begins to actually oxidize that LDL cholesterol. And this LDL cholesterol that is oxidized can now migrate through the clefts or narrowing or in the between the endothelial cells, so that now you've got this bad oxidized LDL cholesterol in your subendothelial space, which your subendothelial space does not like. And it begins to call for the SWAT team, that is to say, our blue macrophages that you see coming from the bloodstream, also finding its way through the endothelial layer into the subendothelial space, where it now behaves like Pac-Man, going from left to right, gobbling up all these small, hard, dense LDL particles. Now, when that gets all the way over to the right, and it is absolutely now chock full of all these LDL oxidized particles, we in medicine do what we do so often. We change the name. This is now called a foam cell. And the foam cell is nasty because it produces these substances we call metalloproteinases, like stromelicin, elastase, collagenase, and myeloperoxidase. What do they do that is so bad? They progressively erode, as you can see in the figure on the left, they progressively erode the cap over the plaque. The cap over the plaque becomes so eroded that the sheer force of blood racing over that thinned out cap ruptures, breaks. And now we have the extravasation, or the oozing out of, if you will, of plaque content into the flowing blood, which behaves, making everything sort of thrombogenic, wanting to clot, activates our platelets. And sure enough, in the middle of the slide, you can see there's a figure where at the point that the plaque is ruptured, the clot is now forming. And that clot is in and of itself self-propagating until in a matter of further minutes, we get all the way over to the right-hand side. And that is 90% of your heart attacks when you rupture your cap over the plaque and you develop this thrombus and a clot. Now, if I do my job correctly today, hopefully all of you, and maybe your maybe your friends and relatives, will recognize that they can make themselves heart attack proof. How are you going to do that? We're not going to do it with a stent or a bypass or with drugs. We're going to do it by changing your biochemistry. How are we going to change your biochemistry? By changing your food. So that when we change your food, all that really, that telltale that I've just shared with you, that series of worsening events is not going to happen. You will not have an LDL cholesterol getting oxidized. You will not have the development of the foam cell or metalloproteinases. Therefore, you will not weaken the cap over your plaque. You will actually strengthen the cap over your plaque. And when you strengthen the cap over the plaque, it cannot rupture. And when it cannot rupture, you have made yourself heart attack proof. How long do you think that'll take? I should try to give you evidence tonight that 3 weeks should get it done if you're 100% committed to whole food, plant-based nutrition. Now, you can forget the x-ray here, but I want you to look at the opening of the artery. And here the artist has drawn for us an opening that is half filled by plaque. And you can see that the part that is open still is nicely lined by that single layer of endothelial cells. Now, we used to think of the endothelial cells for many years as these cute little red bricks that were sort of lining our pipes. But that all changed in 1980. In 1980, Dr. Furchtgott, working in his laboratory in Brooklyn, was taking the largest blood vessel in the rodent, the aorta, and he would do this sort of elliptical spiral staircase cut around that aorta, injuring the endothelium. Then he would immerse it in saline and it would constrict. However, one day, Dr. Furchtgott decided, no cut, no cut. And he immersed the aorta in the saline and it dilated. So he did it again and it dilated again. Now suddenly the race was on globally. What was the EDRF that Dr. Furchtgott had discovered? And it was called the endothelial-derived relaxation substance. Now, thank heavens that term was not with us for very long. When at 8 years, in 2000, that is in 1988, 3 men, Dr. Furchtgott, Dr. Murad, and Dr. Luignaro, discovered that the EDRF indeed was a gas, nitric oxide. And nitric oxide, interestingly enough, in 1998, 10 years later, those 3 men received the Nobel Prize. And you might be saying to them, what is it about nitric oxide that makes it deserve a Nobel Prize? Well, mainly it's because of the functions that nitric oxide has. For example, nitric oxide will keep all the cellular elements within our bloodstream flowing smoothly like Teflon rather than Velcro. Number two, nitric oxide is the strongest blood vessel dilator in the body. When you climb stairs, the arteries to your heart, the arteries to your legs, they widen, they dilate. Number three, nitric oxide will protect the wall of the artery from becoming thick and stiff or inflamed and protect us from getting high blood pressure or hypertension. Number four is the absolute key. A safe and normal amount of nitric oxide will protect us all from ever developing any blockages or plaque. So literally, everybody on the planet Earth who has cardiovascular disease has their disease because by now they have so sufficiently trashed and injured their endothelial cells that they no longer are able to make enough nitric oxide to protect themselves from making blockages or plaque. But the good news is this is not a malignancy. It is a completely benign foodborne illness. And once you can get patients to understand that never, ever, ever again are they to pass through their lips those foods that are going to further injure an already train-wrecked endothelium. Now, at this point, there are some other things that I think are so important, and that is usually I look out at the audience about this time, and the audience will, so I can see them scratching their head, wondering, what is my level of nitric oxide? Well, we really don't have a good way of doing checking that out in the office yet, although hopefully it will be coming eventually. And the thing that is interesting is that you can measure this on a research basis, and I want to share with you how that's done. If you take an ultrasound probe and place it over your brachial artery at the elbow and measure, you will see what the diameter of your brachial artery is. Then for 5 minutes, you will encircle the upper arm with a blood pressure cuff. And that blood pressure cuff is then inflated above systolic blood pressure so that for 5 minutes, you do not have any blood flow to your forearm and hand. Yes, I've done that, and it's not exactly habit forming. But then you release the cuff. You release the cuff, and what happens next is you would then re-examine the brachial artery with this ultrasound probe. And in the normal individual, it'll be 30% greater because of all the outpouring of nitric oxide. The last thing that I think is kind of key with this is for people to understand what happens when people eat certain foods. So Robert Vogel took a group of healthy young subjects to a fast food restaurant that is characterized by arches, which are golden. And half of the group got cornflakes and had the brachial artery tourniquet test, boom, normal. And the other hand, the other half of the group had sausage and hash browns. There we go. And after 120 minutes after ingesting that meal, they were no longer able to dilate the artery because of the influence of that meal of hash browns and sausage so compromised and injured the endothelial cells that they were unable to make nitric oxide. However, being young, and they followed them into the late afternoon and early evening, they began to recover. But you and I know that the next morning for breakfast, at most houses, it's going to be scrambled eggs and bacon. And then again at lunchtime, we will have hash brown. No, at lunchtime, we'll have, what do we have at lunchtime? That's terrible. Anyway, also, and then obviously that evening, we're going to have a baked potato with sour cream, lamb chops, vegetables soaked in butter, and of course, ice cream for dessert. But the point I'm making here is that all of these patients who have this and eat in this way throughout the United States. Think of how common it is to have this kind of food. And literally, so we start in childhood, beginning to injure and compromise our endothelial cells. So now we know that even by age 10 or 12, people, the youngsters already have progressive and early disease in their arteries. Now, just for a moment, we're going to summarize again nitric oxide functions. One, prevents stickiness, strongest vasodilator, avoids arterial thickening, prevents blockages, prevents smooth muscle migration, and can destroy Darth Vader, the foam cell. Now, although on this slide, you will see 4 powerful defense mechanisms that we have, too many to discuss tonight, but the top one, the endothelial cell, we are going to get into a little bit further. And now this is, of course, where the rubber hits the road. This is the first, actually, this was the first study that I did back in 1985. And it was really because of my surgical obligations. The study was small. And it did not, and although it didn't have a lot of women in it, our subsequent study did have. And the key here was to see if I could get them not to eat any foods that were going to actually injure the endothelial cell. So I eliminated all oil, olive oil, corn oil, soybean oil, safflower oil, sunflower oil, coconut oil, palm oil, oil in a cracker, oil in salad dressing, and anywhere we wanted to have them eliminate the oil. The same was true of animal protein, meat, fish, chicken, fowl, turkey, and eggs. I also wanted to be sure they got rid of the dairy because of the milk, cream, butter, cheese, ice cream, and yogurt. And I don't like them to have caffeinated coffee. There is this wonderful Italian study showing how caffeinated coffee injures the endothelial cell. Now, for those of you who are a little bit nervous about what I just said about oil, here's one of multiple peer-reviewed scientific studies showing, as you see here, olive, soybean, and palm oil intake have a similar acute detrimental effect over the endothelial function in healthy young subjects. Now, shifting gears just for a moment, yes, all those listed that you see here are animal foods that are consumed by omnivores. And it was Dr. Stanley Hazen at the Cleveland Clinic Department of Cardiovascular Research who looked at the metabolism that omnivores possess. That is to say, they possess bacteria in their gut that will metabolize the molecules of lecithin and carnitine that are seen in these animal foods. And the result is TMA, trimethylamine, which is rapidly oxidized in our liver to trimethylamine oxide. But one of the more exciting things that he found was that trimethylamine oxide would injure blood vessels. And he took it a step farther and he looked at people who were totally plant-based. And when people are totally plant-based, they do not possess in their gut bacteria that can convert lecithin or carnitine into TMAO. So another enormous advantage for being plant-based. And here's a sequence going from lecithin and carnitine, the molecules found in the animal world, that when they hit the bacteria in the gut of the omnivore, gets converted to TMAO, which contributes to vascular disease. Now, there's one slide, and this is it, in the entire presentation tonight that has nothing whatsoever to do, nothing to do with cardiovascular disease. It was a remarkable moment in October of 2015 when the World Health Organization, imagine it, really representatives from countries throughout the world were able to come together and agree that red meat and processed meat had the same level of carcinogenicity as smoking cigarettes. Pretty powerful. So what did we want them to eat? We wanted them to eat all these marvelous whole grains for your cereal, bread, pasta, rolls, and bagels, 101 different types of legumes, lentils, and beans, all these marvelous red, yellow, and green leafy vegetables, and some fruit. No oil. I want to share with you now just a few angiograms in this group. And I should share with you that all these angiograms were reviewed in triplicate in the Cleveland Clinic Angiography Core Laboratory. And so when I tell you a certain degree of disease reversal, I know that it's accurate. What you're looking at here is the left anterior descending coronary artery of a 67-year-old retired pediatrician. And from the arrow on the left to the arrow on the right, it was defined as a 10% improvement. Now, this is obviously as small an improvement as your naked eye can see, a little easier in this circumflex artery to the back of the heart in a 58-year-old factory worker. And from the arrow on the left to the arrow on the right was measured as a 20% improvement. Here we're looking at the right coronary artery in a 54-year-old security guard. And from the arrow on the left to the arrow on the right was described as a 30% improvement. Now, this young surgical colleague and friend of mine, Joe Crow, it was in 1996 that at age 44, he began to get chest pain. Now, he was not diabetic. He was not did not have high blood pressure. His cholesterol was not particularly elevated. He was athletically active, and he had no strong family history. Finally, in October of 1996, he saw cardiology for an evaluation, and the workup was negative. A month later, he finished his surgical schedule and sat down to write postoperative orders when suddenly the elephant was sitting on his chest. Pain in his left shoulder and arm. Joe was having a heart attack, and he was whipped down to the catheterization laboratory where the catheterization was started. He had a cardiac arrest, resuscitated, finished the catheterization, one more cardiac arrest, and then sent to the floors where he stabilized and was able to be discharged 4 days later, but was very depressed. And the reason he was depressed was at the time of his angiogram, the entire lower 1/3 of his left anterior descending coronary artery was all moth-eaten and diseased over too long a segment, really to get too long a segment to get, you can't ram in stent after stent, and it was too far down the artery for the bypass. So Joe was really depressed about this, and so Ann and I had he and his wife out for supper 2 weeks after his heart attack. Joe, look, you've got the typical Western disease. You've been eating the typical Western diet. We've got 10 years of data. Why don't you think about trying plant-based nutrition? So he said, yes, okay, I'll give it a try. They couldn't offer me anything else, but I'm not going to take those statin drugs. I don't trust them. There's too many, got accompaniment here. There's too many side effects. So he decided he would really become the personification of commitment to whole food plant-based nutrition. And over the next 2.5 years, his total cholesterol plummeted. His LDL went from 98 to 38. And then he had 2.5 years after his heart attack, another angiogram. Now, our offices are together up in the surgical office area. And on the day that I knew he had earlier in the morning had his follow-up angiogram, I went over to his office, opened the door, and said, listen, Joe, I understand you had that follow-up angiogram. Can you share with me, how did it go? Well, he got up from his desk, came around, put his arms around me and said, I think we're doing okay. And I said, well, any chance that I could see the follow-up angiogram? And he said, sure. And that's pretty exciting for us. We suddenly, when you think about it, if the plaque is young and the patient seems to be young, and the plaque is made of inflammation, fat, and cholesterol, the body has an extremely powerful capability of getting those cells out of there and reversed, as we see here. Now, here's another gentleman, well, 45 years of age, from Florida, who in July of 2017, as you see here, he had a heart attack, and then he had the angiogram. And you can see the arrow is pointing to a blockage that is 80% blocked. And I guess this is an obtuse marginal branch of the circumflex artery. And he had other arteries that were involved with blockages, such that the cardiologist strongly advised him to have bypass surgery. And the patient said, no, I've got this book, Prevent and Reverse Heart Disease, and I'm going to try to do it with nutrition. And the cardiologist scoffed at him and said, that'll never work. Well, a year later, he came back and they had another angiogram. And what formerly was 80% blocked was now 40% blocked. Now, at this point, there was a change in cardiologists, but the new cardiologist wanted to get an idea of how this was working out. So he got another angiogram a year and a half later after this one. And as you can see now, it's completely gone. Now, we have to take a minute here and really raise a question. This man had an extremely safe procedure of simply changing his food. There is no risk and no added expense, and nothing could be more powerful. And you really have to begin to question why it is that every patient with this disease at least ought to be offered the option of plant-based nutrition. The reason I got the angiograms is that the patient sent them to me when he was, at the same time, he sent a letter thanking me for writing the book. All right. Now, so when the study really was initiated, we had 24 patients, but we promptly lost 6 nice guys, but I had very little money for the study, and they just didn't quite get it. But there were 18 who stuck with us for the entire 12 years. And it was interesting that those 18 that stuck with us, I wanted to know, in the 8 years prior to coming into our study, while they were in the hands of expert cardiologists, how many events of progressive disease did they experience? There it is, 49 disease events in that 8 years prior to coming into our study. However, once they entered the study, 17 of those 18 had no further events. There was one little sheep who at 6 years wandered from the flock, got into the wrong foods, more angina, ended up with a bypass, but he's now back with the flock. But it proves the point of how powerful whole food plant-based nutrition could be. Now, as proud and as excited as I was to see this approach actually working, documented with the angiographic disease reversal, not everybody was excited about this. And as a Dr. Esselstyn, that's a small study. What makes you think you can repeat it again? Dr. Esselstyn, that was not randomized, it was small. So we did another study. And this time that was interesting that we had 200 patients, so 2 were lost to follow-up, 198 patients. Of those 198, 177 followed our program. And that was 89.3, almost to 90%. Now, you might say, well, because one of the common criticisms I get of our study is that other physicians will say, well, we can't get patients to eat that way. Well, if you're going to have patients make a lifestyle change, I think it's absolutely essential that to show the patient respect. And the only way that I know to show a patient respect is to give them our time. So under our present format, our present setup, when we're asked to see patients, we have about once every 6 weeks, a 5.5 to 6 hour intensive seminar where these patients are going to learn all about how they created their disease and precisely how we're going to empower them as the locus of control to halt and to reverse their disease. Now, the other aspect of this study is that since I guess I'm a little old-fashioned, anybody who's going to come to our seminar, beforehand, I like to call them so that I can get my arms around their story, and at the same time, provide them an opportunity to ask questions of me so that coming to this seminar, we have a strong platform from which we can all move forward. Now, yeah, it's working. I think it's working. There we go. So what about the events? In the patients that were adherent, there was 1 out of the 177 who did have a small stroke, but he had the stroke while he was vacationing in China, totally abandoning the nutrition, totally abandoning a whole food plant-based nutrition. And he had a tendency to have hypertension anyway. So although I've included it there, my other co-author said, no, that patient actually should not be included there because 100% of the people who were compliant did not have further events. The 21 patients who were not compliant, 62% had additional events. Now, I wanted to sort of compare our results with some of the larger cardiovascular studies in this country and the one overseas, and compare to see how we were doing. Now, if you look on the far right, that's the Lyon diet heart study, which after 4 years, 25% of the participants had a major cardiac event or stroke. We go one story to the left, the natural history of coronary artery disease. This is a study out of Columbia Presbyterian Hospital in New York City. 20% at the end of 4 years, heart attack, stroke, and death. Let's go to the left one more. Bill Bowden's Courage study. At the end of 4 years, 19.4% heart attack, stroke, and death. Now we go to the left, and there we are. 0.6%, that one patient, if we included. What was the difference? We were treating the cause. And really, there's been a basic covenant of trust between the patient and the caregiver ever since the days of Hippocrates, that whenever possible, the caregiver will share with the patient what is the causation of the illness. All right. Now, so we summarize. No mortality from the diet. No morbidity from the diet. No added expense. And benefits improve with time. And when you think about it, presently, when patients have a heart attack, they are sadly having to walk around all day long, carrying the Damocles sword hanging over their head, wondering when it is that they're going to have their next event. Now, here on the left, you're looking at the pulse volume on the ankle of a 54-year-old patient with heart disease who, in addition, had a partial blockage of an artery in his thigh. So that when he came to my office and crossed the skyway, he had to stop 5 times, waiting for the discomfort and pain in his calf to go away as additional blood finally flowed into it. And I really totally forgot about his leg when about 10 months into the program, when he came for an office visit, he said, Dr. Esselstyn, do you recall when I first started seeing you that I had to stop 5 times crossing the skyway to your office? Yes. He said, Doc, I want you to know in the last month, I no longer stop. The pain is gone. I said, well, then let's do this. Let's repeat the pulse volume. And you can see on the right, the pulse volume was now absolutely doubled. We suddenly had now absolutely irrefutable, rock solid scientific proof that food and food alone could absolutely reverse cardiovascular disease. And somebody's going to say, well, wait a minute, what about the statin drugs? Well, look at the dates. It was 1986 there were no statin drugs. Now here, another one we have, this is if I can get this there. What you're looking at here is the image of a 78-year-old retired high school chemistry teacher who, in his retirement, he and his wife loved to enter square dance contests. But during the fast square dance, he was getting bilateral calf pain. And he saw some vascular surgeons who got these images, and you can see this absolute ravaging disease. But when he came to see us, and because he didn't like the idea of the big operation that was being proposed, and he said, Dr. Esselstyn, if I choose your method, how long will it take me to get rid of my calf pain? So I looked at him with great wisdom in my face. And I said, probably about 9 or 10 months. 3 months later, I got a phone call. Dr. Esselstyn, you do not speak the truth. The pain is gone. No, I don't know quite what it's like in Wisconsin for you, all you folks, but when here in Cleveland, if you're watching a sporting event on television or a mystery, just before the advertisement comes on, you will hear the mellifluous tones that the announcers say something like, when the moment is right, will you be ready? Now, we all know that the penile artery is much smaller than the coronary artery, and not infrequently, before somebody comes down with heart disease, they'll find that they're no longer able to raise the flag, shall we say. But all is not lost. And when I get a phone call from somebody, it goes a little bit like this. Doc, this is Mr. So-and-so. Yes, nice to hear you again. Yeah, Doc, I said, I really thought I ought to call you because once again, something has come up and I think I owe you another check. All right. What you're seeing now is a PET scan. Now, this is going to take a little bit of explanation, so I'll go slowly on this one, but it's very important. The PET scan on the left, if it's orange or yellow, it means this is, of course, a configuration of heart muscle. And if the heart muscle is reflected as orange or yellow, the circulation is quite good. But you can see on the one on the left, on the right-hand side, it's green. And it's green because it's a poor blood supply. So I counseled the patient on that day. And 10 days later, his cholesterol had fallen from 248 to 137. And then 3 weeks later, we repeated the PET scan. And now you can see the area that was green is now totally restored. So what's going on here? This really had me puzzled. And so I talked to, because how can you in 3 weeks, how are you going to remove something that's a blockage like that? So I spoke to Rodriguez, who is the chairman of cardiovascular pathology at the Cleveland Clinic, and he dissects 200 hearts a year from those who are obviously deceased. And I said, how often do you ever see blockages or plaque in those hearts once those 3 major arteries have dived into the heart muscle? And his answer, never. So look here. Here you are looking at a heart that is really nothing but all of its blood vessels. You have the 3 major arteries, the right coronary artery, the left anterior descending, and the circumflex. And what do? They all dive, as you can see here, into these thousands and thousands of intramuscular vessels, which do not have plaque, as Rodriguez said. However, now I knew the answer, because what occurs when these patients come in to see us, and they're really quite sick, they're barely making any nitric oxide or endothelial produced nitric oxide. It's very modest. And also, when your arteries are that sick, your endothelial cell is now your enemy. It is making 2 molecules of endothelin and thromboxane. And endothelin and thromboxane are what we call vasoconstrictors. They narrow these arteries. So all those thousands and thousands of tiny little blood vessels that you see there are pinched and narrowed, not because they have a blockage, but because they're sort of, for lack of a better term, they're a little bit in spasm. But they have so deprived the heart of oxygen and blood supply and the lack of nitric oxide that it is always, to me, very stunning, especially with people who have stable angina, chest pain. Often you can see within 2, 4, 6, 8, or 10 days, when they completely change their diet and do it correctly, their pain is gone. Why? Well, when you think about it, looking at those thousands upon thousands of intramuscular tiny vessels are no longer narrowed. They all suddenly become dilated. And if you recall in physics, Poiseuille's law of flow through the hollow viscous is related to the fourth power of the radius. Translation, a tiny increase in diameter, a huge increase in flow. And this is why it makes me confident that how rapidly aggressive this change can occur within literally days or weeks. So if we measure the way of disease reversal, that proves that we've seen it by angiogram, we see it by stress tests. I've shared the PET scan reversal with you. We've seen it with carotid ultrasound, reversal of the disease in the carotids going to the brain. I've shared with you pulse volume, and the 3 symptoms that go away are angina, claudication, and erectile dysfunction. Now, for those of you who actually have not gotten to Cleveland very often and wonder what's going on, and that is a building, though the A building that I worked for 8 years. No, I worked for many years on the 8th floor as a surgeon. The other thing that I think I'd like you to see in this is what the trees look like in Cleveland in February. However, after I retired from surgery and I got involved with heart disease reversal, I was hired by the Wellness Institute, and although the budget is more modest there, the morale is quite high. And one thing that I've learned in some 60 years since medical school, brains are important, but nothing is as important perhaps as persistence, best exemplified by this young damsel in Life magazine, 1939, trying to learn how to do the splits. But it is tough to do the splits, but she stuck with it. And sure enough, the other day in Wisconsin, somebody spotted her and she had got it right. And I want to thank you for your patience and and your willingness to listen. Thank you.
Thank you so much, Dr. Esselstyn. My goodness, you have taught, I've been doing this for a long time now, or been plant-based, and have heard presentations from you. There's always something new, and I was surprised how much that I had forgotten that you reminded me of here. But my goodness, what a marvelous thing you found. What a wonderful thing you continue to do, letting us know about how this works and what a difference it can make in our lives and the lives of our loved ones.
Well, I want to, if you have any questions, I'd be
Right.
glad to answer. On the other hand, I do want to add one thing that sometimes people forget about when they think about whether they change their food or not. Remember this: every single patient that I have ever seen with heart disease, or that anybody in Wisconsin has ever seen for heart disease, or Missouri or Utah or whatever, anybody who has heart disease at one time did not have heart disease. Right?
That's right. That's
So,
yeah, it's one of those things that you don't stop to think about, and when you do, it's pretty powerful.
All right, there's some questions you want to put in the chat.
Yep, and Brian, have you looked at the chat?
Yeah, I've been looking at the chat, and thankfully some other people have been answering the questions. And so some people who obviously know what they're talking about. So they're answering the questions very well. I thought that here someone says, Dr. Esselstyn, is there a limit on the amount of green leafy vegetables that can be consumed along with cholesterol drugs, since vitamin K can clot the blood?
Yeah, I wouldn't worry about that clotting. We've been doing this now for really a number of decades. And I didn't go into it because we had a little bit of a time crimp, but I want to address the green leafy vegetable thing, because by now I hope that everybody, from what I have said, understands that heart disease is caused as you lose nitric oxide as a protection. That it seems to be quite absolutely important. And is that the question?
So the question was about like leafy greens.
Oh,
and
yeah.
Can they be
Well,
consumed with cholesterol drugs? Are you
no,
worried about vitamin K?
Yeah.
So what's your take on
No,
vitamin K?
Well, I want to finish on nitric oxide for a minute.
Yeah.
Now, there are two ways that we get nitric oxide, and I made a major change in our program about a decade ago for this. And that is that when you have a healthy endothelium, it's really making the nitric oxide that you need. But the other thing is that when your endothelium is no longer healthy, we have embraced, there's a newer method or a newer knowledge that mankind has an alternate pathway for making additional nitric oxide. So I want to spend just a moment on that. And that is when we get people to chew a green leafy vegetable, roughly the size of 1/3 of a cup, after it has first been steamed or boiled 5.5 to 6 minutes so it's nice and tender. Then you must anoint it with several drops of a delightful balsamic or rice vinegar. Why? Because the acetic acid from those vinegars has been shown to restore the vinegars, so that what happens is that those vinegars will affect the nitric oxide synthase enzyme, which is contained within the endothelial cell and responsible for making additional nitric oxide. So we ask people to chew this alongside your breakfast cereal, again as a mid-morning snack, again with your lunch and sandwich. That's 3, mid-afternoon 4, dinner time 5, and of course I adore it when they eat that evening snack of arugula or kale. Now,
So what about vitamin K? Do you feel like
vitamin K is with that healthy ingestion of green leafy vegetables has not been a problem. Yeah.
Spinach, Swiss chard, beet greens.
Yeah,
Yeah.
we'll get to
what are the top 5?
the
No.
top 6
No.
are kale, Swiss chard, spinach, arugula, beet greens, and beets.
But not too much all spinach.
Now the other way that green leafy vegetables works, a green leafy vegetable will the second to benefit from it. It will restore the capacity of your bone marrow to once again make the endothelial progenitor cell. The endothelial progenitor cell will replace our senescent, injured, worn out endothelial cells. And the third benefit, when you're chewing a green leafy vegetable, you are chewing a green nitrate. As you chew that nitrate, it is going to mix with the facultative anaerobic bacteria that reside in the crypts and grooves of your tongue. Those bacteria are going to reduce the bacteria that you've been chewing from nitrates to nitrites. And when you swallow the nitrite, it is now your own gastric acid, which is going to further reduce the nitrite to more nitric oxide, which can enter your nitric oxide pool. So think about it, what you're doing for minimal expense and no hideous side effects. All day long, dawn to dusk, morning to night, you are absolutely restoring nitric oxide, the very molecule, the deficiency of which gave you this disease in the first place. Now, there's a caveat to this, that toothpaste with fluoride, public drinking water with fluoride, and mouthwash will injure the beneficial bacteria in your mouth. And I do not like antacids because antacids will decrease your gastric acidity and you will be unable to reduce the nitrite to more nitric oxide. And if you want to listen to all the vegetable, I give you the top 6. But if you want the whole list, it goes like this. Bok choy, Swiss chard, kale, collard green, beet greens, mustard green, turnip greens, snappy cabbage, Brussels sprouts, marguerite, cauliflower, cilantro, parsley, spinach, arugula, and asparagus. And the reason I do it that way is because you have to know how powerful it is for restoring your memory.
That's excellent. I love it.
Right. Somebody has a question about, can your LDL be too low?
Theoretically, it could be, but I don't know.
This person says they have a 62 LDL. Is that too low?
Yeah, well, let's see what it's like without medication.
Yeah, are they on it if they're on
If
medication?
If anybody gets rid of their medication, I think with eating normally without drugs, you're not going to have an LDL that's too low.
So this person says no medication. So that's pretty amazing.
But what was the cholesterol?
62. Oh, what's the total cholesterol? Let's see what they say.
What was the LDL?
LDL was 62.
That's okay.
Yeah, that's okay. That's good.
That's fine.
Someone said, is that too low?
No, if you get that way naturally, no, it's not too low.
How about L-arginine? Would you recommend having patients take it?
The whole idea of L-arginine is to stimulate the production of the body, making more of this nitric oxide. This is what the goal is. But when there was a test, when you put it to the test in a large study, there were men who had recently had a heart attack divided into two groups. One was a control group, and the other group continued to take the L-arginine. They prematurely stopped the study after 6 months because they found there were 6 new heart attacks in the group that had previously had a heart attack who were taking the L-arginine. In the control group that were not taking the L-arginine, there were none. No.
Oh, interesting. Wow.
So there seems to be a little bit more workout that has to be done to try to spearhead that approach.
Yeah. How about aortic aneurysms? Can you prevent or reverse aortic aneurysms?
No, the diet will not do that. Once the wall of the giant artery, the aorta, once the wall, which is made up of muscle and collagen, once those fibers become separated, in this high pressure system, there's begins to be this swelling because of that breakdown. And no amount of whole food plant-based nutrition that I'm aware of can reverse that. However, there are obviously better ways to do that, even from a surgical standpoint. They can actually run up a sort of a Teflon mesh or weave that absolutely will take all the burden off the walls of the aorta.
How about what's the safest way to reduce your statins when you go whole food plant-based? I know you always make great recommendations of working with people's cardiologists.
Well, I think you have to work with the physician who is prescribing the statins for you. And the important thing about the statin is it may be helpful, but if you want to modify it, you really should talk with your doctor. And what will happen when you start to eat whole food plant-based nutrition, even though you are taking a statin, your cholesterol will probably fall so profoundly that it will not be hard for you to get him to cut it in half. And then you continue that, and you may get him to cut it in half again. But at all times, I would respect your physician and see if you can't do it with their understanding.
Yeah, but they're never going to recommend it, right? They're always going to want to be safe. You have to drive the conversation.
Yep.
Is there research about supplemental nitric oxide tablets? Have you seen any research on that?
There is preliminary research, and I have not seen the one that I have to see before I will really commit to it, and that is I need to see a study where the nitric oxide tablets have been used in patients who are seriously ill with heart disease, and see if that will get them to halt and reverse their disease. Because right now, doing this approach with green leafy vegetables, I kind of feel we've got a winner, and it's safe and it's inexpensive, and it's also something that patients can understand when you get them to do this. You define for them the entire mechanism of action.
Yeah.
And I think that that's what I would prefer but I'm going to be completely open-minded if that study comes out and it's safe.
How about omega-3 in patients who are plant-based? Do you ever suggest people take omega-3s?
I suggest they can get it drawn if it's optimal, or you're fine. If it's borderline, you might want to consider taking omega-3 algae.
Yeah. Here's a great question we haven't had before. What do you think are the next growing edges for research in whole food plant-based nutrition? Like what do you think's on the horizon? Certainly microbiome, right?
No question the microbiome will be studied more. But I think that I'm deviating now to what happens every 5 years when the United States Department of Agriculture puts out for the public a food list. And not surprisingly, guess who it is that comprises the United States Department of Agriculture? All these people who are presently president of the Hog Board, the Cattlemen's Association, Mars
Candy bars.
Yeah, I mean, it's just there is such enormous conflict that we're never being told that these are the foods that'll harm you, that'll give you this disease by the time you're 17 years of age. I mean, this is crazy. When you have all these cultures on the planet, or did have them until they switched to Western diet. They all want to be the American diet and have meat 5 times a day because it's crazy.
What do you think about recommending L-citrulline for potential increase of nitric oxide?
I don't have, I'm going to confess, I don't have, I would rather do that and with a safe way that I am using right now with green leafy vegetables, but I will remain open-minded and let's see how those studies with citrulline work out.
All right, and I always want to ask you this question because I think everybody wants to know, can you talk about alcohol and can you talk about caffeine?
Well, I think if you've got atrial fibrillation and cardiac arrhythmias, I'd certainly stay off the coffee with caffeine. And there's also, the reason I'm hesitant to use it or advise that is that there is a wonderful Italian study that clearly shows that when you're drinking coffee with caffeine, you injure the endothelial production of nitric oxide. What was the rest of the question?
What do you think about, what about alcohol?
Well, alcohol is a toxin. And for years, there was all this sort of fumbling in the scientific community about, well, maybe it's going to be a little bit will help. But now it seems that both in the United Kingdom and this country, the word is out that it's something you don't want to do.
Yeah.
It's toxic to your brain, toxic to your heart, toxic to your liver. And for women, of course, it's a serious risk factor for breast cancer.
But because you're such an easygoing guy, though, what do you usually say about Saturday night?
Well, if they're not looking the other way, and they tell me it wasn't Dr. Esselstyn said it, you can have probably a half a glass of wine, beer, or similar on Friday or Saturday night.
Someone said, can you comment on black seed oil for improving nitric oxide production? But I can't imagine you would feel good about any oil.
Well, I don't, and I'd have to see the study.
Yeah. Is it just caffeine or tea as well?
No, caffeine, tea with caffeine apparently, and black tea and green tea are okay.
Yeah. Any thoughts about COVID and mRNA vaccines and their impact on cardiovascular health?
Yeah, that's an excellent question. There are some suggestions that myocarditis can result. Hopefully that will remain in a small percentage of people, but we have to really remain open-minded about this as a possibility of
That the vaccine causes a myocarditis? Wow, interesting. I didn't know that.
Well, we're bumping up against 7:30 here. Maybe 1 or 2 more questions if we've got them. I don't see any right now. Let me ask, you were talking about the a third a cup of steamed or cooked greens a number of times during the day. Is microwaving okay?
Sure.
Yeah.
Microwave.
Yep.
You
Get them
said-
in any way. We always say get them in any way you can, fresh, steam. But the studies that have really looked at this and usually involve cooking them and using vinegar. So rice vinegar or balsamic.
Yeah, balsamic or rice vinegar.
And one of the questions I was going to ask, doesn't matter what age you start on a program like this, and I think you pretty clearly said it's, what did you say, an 87-year-old, I think, that was
Yeah.
one of the examples that,
Did I tell you about him?
right.
No. Stanley, tell him about Stanley.
Oh, this is a gentleman who came to me when he was 87, and he had been told, he was from California. He had been told that he had to have open heart bypass surgery, and he was convinced that that would kill him. And so he went for us with plant-based nutrition. And every year he'd call once or twice to let us know how he was doing. And then last year when he called, he asked for Anne. And he asked for Anne because he wanted her to give him plenty of recipes because he was going to have a party. Finally, Anne said, well, what's the party for? And he said, well, I'm celebrating my 100th birthday.
Very nice.
And this year when he called to remind us that he was now 101.
Holy mackerel. Oh, that's outstanding.
Someone
think-
has a question about hemp seeds or chia seeds for omegas, right? Like you're a fan of chia seeds and flaxseed meal. You don't eat hemp seeds, but they're
That
okay.
is good for,
Yeah.
for omega.
Yeah, hemp is good. Yep. Put them on the cereal.
And I did see something here from Kevin asking about the possibility of closed captioning, and Brett is on here, our tech person, and I'll be talking to Brett afterwards to see if that's something that we can do.
Yeah, I guess I could address it right now if you'd like. Once we upload this video to the YouTube channel, usually it takes a couple hours to process, but closed captioning will be available on the YouTube video. So,
Oh, excellent. Thanks, Brett.
Yeah, so just quickly, everybody, my name is Brian Hart. I'm the executive director of the Esselstyn Foundation. If you're interested in getting our weekly newsletter, you can go to our website and sign up for it by just clicking on the contact button, and then it gives you a chance to check a box and get the weekly newsletter. We're a 501c3. If you're interested in bringing some plant-based messaging to an organization that with whom you're affiliated, just reach out to us via email. And it's on our website, and we'd love to talk to you. So thanks so much, Terry, for having us again.
You're welcome. Thank you
Newsletter
so much.
is
And we,
The weekly newsletter is awesome.
I think,
turn the camera around so we can see
yeah, I
Anne.
think that is,
There she
I think
is.
that's Ann. There we go.
Don't
Hey,
miss
Ann.
the weekly newsletter. We've been
Well, we-
hearing about you, Terry, how wonderful you are.
Oh, thank you, Ann. Thanks, Brian. I imagine that was from Brian.
Yeah.
So I want to thank, and Ann, and Brian, and Jane will all be speaking to us in November. So we're looking forward to those recipes. And I think I forgot what it was. You set a timer up and
Oh, yeah. 15-minute meals. Yep.
Oh,
so Dr. Esselstyn, thank you so much for taking the time to do this, and so much for what you have done for so many people and continue to do to this day.
Terry,
You're,
thank you.
you're a treasure.
All right.
All right. Have a great night. Thanks. Take care.
Thanks. And just for everybody, very quickly, our next monthly meeting will be Thursday, May 9th. Our featured speaker, Dr. Andrew Freeman. If you'd like to receive notice of this or any of the upcoming PBNOW events and are not currently on our list, just Google us at PBNOW. And if you want to see past videos of our past meetings, go to the video library section on our website or visit us on YouTube just by typing in PBNOW. Thanks again to our speakers, Dr. Esselstyn, Dr. Lieberman, and Michelle Stam, for sharing their valuable time and knowledge with us tonight. And thanks to all of you for coming tonight. Good night, and we hope to see you again next time.